Hello, everybody. Thank you for joining me today. My name is BJ Kowalski. I'm the CEO of ROE Dental Laboratory. I'm delighted to be on Viva Learning, sharing with you the topic, hybrid implant digital dentures, faster and better. A little bit about me. I've been the owner of my company for about 15 years. ROE is a company that's been around since 1926, and we're highly vested in digital technology and digital dentures. And as a large provider of different types of implant restorations, this subject of integrating digital dentures with implant dentistry is a big one for me. So I thought before we talk about digital implant dentures, I thought I'd go through several things on the presentation. We'll talk about the state of digital dentures, why digital versus analog, printing versus milling, and then we'll get into full arch implant supported digital dentures. And I'll present 3 different methods of immediate load digital dentures, 2 of which may be brand new to you, and 1 of which uses a convergence of technologies, which I think can be a game changer, not only to the doctor and the clinician, but also to the patient. So I first started speaking about digital dentures back in 2018, and a lot has changed in this technology since then. And in my mind, it is definitely a technology of today, not of the future, and it represents the majority of the dentures that we produce currently. So the state of digital dentures is really the embracement of technology. 3D printing and milling is increasing not only in labs, but in mainstream dental practices. In fact, just yesterday, I had a conversation with the vice president of Sprint Ray, and one of his sales managers mentioned to me that the #1 question he gets from his 35 sales reps around the country is how dentists print immediate dentures in their practices. So this isn't just technology for dental labs, it's technology that dentists are trying to incorporate into their practices. Another fact about digital dentures is that 53% of offices now use an intraoral scanner. And in the past, using an intraoral scanner for digital dentures has been a challenge, but it is getting better all the time. Clinicians are getting better at using that technology. And whether they're taking a scan of an existing denture, which is working very well, or whether they're scanning an arch, or whether they're using a desktop scanner with a lab and taking models, the use of iOS scanners is growing steadily. And these technologies are proven. CEREC, milled dentures, zirconia crown, digital CAD/CAM technologies are proven across all the products, the indirect products the doctor provides. And now it's really time for dentures. Other facts about digital dentures is that the dentures itself are not going away. Digital dentures by the U.S. Census Bureau, or dentures in general, are expected to grow 38% over the next 10 years. And you couple that with the fact that skilled dental laboratory technicians who can do this work are being very, very few. There's very few dental schools. In fact, one of the recent journals I just read today was about just a very few dental schools and how many are in danger of closing in the marketplace. So there's not experienced technicians able to produce these restorations and appliances. So I think technology will be our solution. So in the future, digital dentures will be the solution where less technicians will be able to produce more dentures to meet an increasing demand in the country. So I wanted to speak a little bit about why digital dentures in your practice versus analog, because if you're going to consider using digital dentures for implant dentistry, I would think that you'd need to be convinced that it's a viable option for conventional dentures that aren't implant supported. So in general, digital dentures have a bunch of advantages. One is a cost savings. Premium dentures at a lower cost. Digital dentures provide a very quality product, but it can be more economical to make. And in many instances, digital dentures allow you to have less appointments. Currently in our lab, we often go right from a bite rim to a try-in of a final finished denture, knowing that if we needed to make changes, we'll just remake a new denture as opposed to having a try-in. If 70% of the time the denture is successful at the initial try-in, if we get the right records, which I'll speak in detail about, then why not go for the try-in right out of the gate and provide a finished denture at the second appointment. Time savings is another advantage of digital dentures. It's a faster turnaround time in lab. There's less processing step. The actual processing time is less. 3D printing is increasingly getting faster and faster and faster. What used to take a day now takes an hour. And most digital dentures, considering custom tray, bite rim, take less than 5 appointments. And in fact, many of them can get down to 3 appointments with digital dentures. It's a tremendous time saving for the practice while providing a very high quality product. Superior strength is another advantage of digital dentures. Initially, back in 2018, when we started doing these cases, strength was a problem. If you had a digital denture and you dropped it on the floor, it would break. That is not the problem anymore. The newer materials on the market, both printed and milled, are very strong and in fact stronger than conventional processed dentures. And I'll show some statistics about that. Other benefits of digital dentures is that most of dentures today, either printed or milled, are done with monolithic, either a monolithic block of teeth or made out of a monolithic single disc of teeth, which if the teeth are all connected is much harder to lose a tooth. It's harder to break a tooth. They become stronger. And we've had really good success with that. And if you do end up something breaking or losing, it can be replaced quite easily. Superior retention. Reports show that digital dentures get better retention than conventional dentures. In fact, several years ago, it was probably back in 2019, just before COVID, we stopped putting post-dams in our digital dentures because we had more fit problems with the post-dams in than out. Post-dams were created to eliminate the processing error inherent in the denture processing that's been around for 100 years. With this new technology, the scans and the details are so accurate, we don't need to compensate for shrinkage. So post-dams are a thing of the past with digital dentures, and they get better retention. It also has greater patient satisfaction because it's more accurate in not having those processing errors. There's fewer post insertion adjustments. Like I mentioned, digital dentures are accident ready. Should anything happen and a denture be lost, what we do in our lab, and I think in most labs would do, is keep a record of this denture so they can easily and quickly reproduce the denture. Patient has a denture, they're satisfied with it, and 5 or 10 years down the road, that patient wants a new denture, and we can easily reprint it, can be realigned to any kind of tissue changes, and it can be given back to the doctor to place in the patient's mouth with very few appointments. As mentioned, this computerized precision fit eliminates the shrinkage and distortion. And there's lots of options with digital dentures. There's different materials for different applications. We can use some materials that are faster to do clinically right there in the office. We could use some materials that mill and take a longer period of time that can be very, very strong in the mouth. But the main reason I think digital dentures is better is really because of the software. And frankly, people do it better. Computers do it better than people in a lot of instances. With a great dental technician, you're a friend of would have a dental technician that is setting teeth for 50 years. He knows exactly what to do, and they basically does the same thing. The software does the same thing as a very experienced dental technician would do. They analyze the landmarks in the patient's arch. They position the teeth upon them and basically fill in the gaps. So when we do digital dentures, the first thing that they do is we indicate the maxillary tuberosities, the incisive papilla, the canine position, and then deepest points of the mucolabial fold. We do the similar thing on the lower arch using the retromolar pads in the center of the ridge, the canine points in the mucolabial fold. And once we have all that information in, it sets the teeth into position for our technician to adjust where we think they should fit and according to the doctor's instructions. We think it's super important on all digital denture cases to include a picture of the patient. We have especially on full arch implant supported implant cases, it can make the difference of a great occlusion and patients with midline and tooth position that's in the right position, or a case that the patient is dissatisfied with. So in digital dentures, more so than analog dentures, because when we would set an analog denture, we literally would be comparing, you know, an articulator to a photograph and trying to match it and interpret what it does. When we have pictures within digital dentures, it allows us to actually set the teeth within the scope of the patient and taking, you know, things like the intervermilion border of the lip into consideration, and do a fantastic job on setting up these cases, which allows us to, you know, oftentimes, you know, skip appointments and go right from bite block to a finished denture on a conventional digital denture. But it's really the software that makes the difference. You know, just like in crown and bridge, you know, technicians that do single posterior crowns, you know, no longer have to really memorize and study, you know, primary and secondary anatomy to make a molar, because the software takes that out of it and builds that in automatically. And those are the same kind of things that the digital denture software does. We believe that currently that 3Shape is a very powerful digital denture software package. exocad does as well. There's some other players on the market, but those are two that we have familiarity with and use, you know, often in our laboratory. So let's talk about a little bit about printing versus milling. So the benefits of printing versus milling. Well, several years ago at a 3Shape dinner I had in Chicago, where they had some of the speakers that were speaking for 3Shape. I sat next to Eric Kukucha, who is a very talented denturist out of Canada. And he was a big fan of milling dentures with the Ivotion system, while I was, you know, quite the fan of printing. And I have actually, you know, initially I felt that there was no way that printing, that milling could be as, you know, as provide the type of results, the faster results as we could with printing. But I have become quite the fan of milling dentures over the last year. We print the majority of our dentures in our laboratory. We have several systems in our lab. We use several PM7s for milling dentures. We have about a dozen IMSI core machines for milling blocks of PMMA. We print on 5 carbon machines and another 40 other printers for other purposes. Mostly the carbons we use for Lucitone dentures. So there's pluses and minuses of each. So clearly the most economical is printing, you know, with the tooling cost involved in milling dentures, the block cost involved in milling dentures. That's a downside. It's definitely more economical to print than it is to mill dentures. And it also, printing also provides the fastest turnaround time on those prosthetics, because we can mill something, print something, you know, much faster than milling. That being said, with some of the milling, when you're milling a monolithic block, such as the Ivotion, or just a monolithic block of PMMA, there is some extra legwork to be done on PMMA. You have to color the tooth colored material to make it look tissue colored, where Ivotion is already pre-done. But any way you do it, printing always seems to be a little bit more efficient to get a case done. But the benefits of milling are significant. They are the highest strength prosthetic you can have, which in this topic of implant dentures, it's important that, you know, we have the highest strength and you're having something that's implant supported. And I believe the aesthetics are better. The aesthetics we can get out of a milled tooth versus a monolithic printed teeth is superior. Printing is going to come along steadily, but right now most of the materials are monolithic, where when we're milling a tooth, we can mill it in a multi-layered incremental gradation of shade, where printing tends to be one particular color. So there's pluses and minuses to each. We're not biased because we use and appreciate both technologies. So when it comes to milling, there's really 2 options with milling. So there's a 1-disc solution, where you're milling out of one material that has the teeth material in it as well as the gingiva material. And then there's a 2-disc solution. We use the Ivotion for both of these. We also use a solid block of PMMA to mill and colorize with a creoline type material, but you have the Ivotion Dent and the Ivotion Multi. So you're basically milling the teeth and milling the base and gluing them together with a one disc solution that I'll show you here next slide. It's all done in one, which is pretty miraculous. So this is the Ivotion one disc solution. As you can see in this picture, the teeth are actually built right into the puck. So when this comes out of the puck, it is, we had polished that by hand to make it look a little prettier for the photography, but it came out without any adjustments to the anatomy of the restoration or the gingival architecture. It is milled to a state that it just needs polished when it comes out of the mill. So Ivotion is basically a 3D two structure and architecture and a unique shell geometry, which was very impressive how it was created. But it has a large library of teeth that we can choose from. So we can basically choose a shade of the gingiva and a number of different molds of teeth, and it can be milled and finished out of a single disc of material. And this is how it's created. And I think this is really why it's great for implant dentures, because as you can see, the clear part on the left side of the screen is where the tooth material would be, and above that, where the pink would be the gingiva material. But it actually, we actually have this restoration nested in the puck, and we manipulate it to fit within the confines of this geometry where these shells are, where that allows us to create the gingival architecture of the teeth. So that allows one puck to mill everything at once without any changes, which has some significant advantage for implant cases because that adds to strength. So this is how the puck would look: half teeth colored, half gingiva, and it has a nice stratification scheme of the disc. And the dentin represents the largest share, but the incisal is clearly visible by the eye, where it has a lighter color towards the incisal edge. This is a highly cross-linked PMMA, and it's a uniform strength throughout. So the pink and the tooth colored material have the same strength throughout the material. So some material properties of Ivotion, and there are options with a solid milled puck, but Ivotion is the only one that has the teeth and the pink tissue material all in one puck to mill together. So this material from Ivoclar represents, they have 2 times the strength of their conventional Ivo-based system. So the Ivo-based CAD pink with prefabricated normal denture teeth has 50% less strength than when it's milled as a monolithic block of material. And when you're looking at something for strength for an implant restoration, that's pretty significant. And it also has wear resistance that's very similar to the SR Vivadent PE teeth, which is a tooth that had been very popular and used in patients around the world for many years. So the load to failure is important on implant cases, because anyone that does full arch dentistry knows that you don't want these restorations to fail. So unfortunately, to date, there's no specific test methods that have been defined for testing denture material discs for strength. So in light of that, Ivoclar did some tests where they basically used the similar tests that they'd use for a regular denture to test these monolithic milled denture. And this was a pilot study that Ivoclar had done on load of failure and work of fracture. And they're still in the process of fully documenting this. And these are some preliminary results, but I think they're important. And it certainly, provides some confidence to me as someone that's going to be responsible if something breaks, that this is using a milled digital denture is a viable option and maybe a better option than others on the market. So this is the load to failure test that they did initially, and they basically compared, and the gray bar was the Ivo base, which is a conventional Ivo cap system. It changed the name to be Ivo base, but a conventional injected acrylic with denture teeth, compared to milled, the yellow bar, milled teeth with a milled base that are then adhered together. and the green bar would be the Ivotion. So you can see significant strength increases over a conventional denture using advanced technologies, not even speaking about a conventional denture with the old press pack system, which would be less than the Ivo-based. So that would be, significantly less than the results of the Ivo-based system. Now, that being said, comparing those to a Lucitome print, a carbon denture, they found that in their own studies that the monolithic milled Ivotion denture was significantly higher than a printed alternative. And speaking with Bill Barton, who was one of their technical support people, he was able to get the scientific team over at Ivoclar to do a test for me. The picture at the right is a converted denture that you'd use for an implant restoration with large holes put in it. We would do these ahead of time as part of a guided surgery procedure that I'll explain. But he did the same test that he did on all these other areas with a converted denture with holes in it, with the holes filled with conventional cold cure acrylic. And when he did that test, he found that it was still very, very strong and almost as strong as a regular Ivotion case, even though it had those weak points of having holes where one might pick up implants and temporary cylinders in an immediate load case. So I think this is some compelling initial evidence. I think more needs to be shown on this, that a solid milled denture like that has a real place in the standing as a choice for a fully loaded implant case. Another study of work to fracture, which was also impressive, that the Ivotion kind of comes ahead, and this is basically a combination of the ability of this to how much stress it can take and how long it can take the stress before it breaks. But the Ivotion clearly was well ahead of the other ones in this initial study of work to fracture. And finally, tooth debonding. There is no tooth adhered in these kind of cases when it's milled in one solid block. So in tooth debonding also showed it to be high. Now, number of these statistically, all of these numbers are good and are very fit for use in the mouth. But when you're talking about an implant case, it makes sense in my hands to want to gear towards what is the strongest. So that also proved to be, pretty impressive. So what are the drawbacks of digital dentures, either printed or milled? So there's loss of hand craftsmanship for sure. In the aesthetics a little bit. I think, our great technicians that we have here can do a little bit nicer job with a conventional denture than a digital denture. And certainly the aesthetics of the teeth. The beauty of denture teeth that have been, created by, many companies like, Colzer or Ivoclar or Vita, many leading companies in the marketplace. They have a lot of depth of translucency, depth of color, internal gradation that you can't achieve with either of these technologies. But the teeth aside, I think the aesthetic can be very, very close to what you can do, because you can festoon and contour a digital denture just like you do a regular one. And the learning curve of digital dentures can be steep, particularly if you're not used to that technology. And then just like conventional ones, staffing digital dentures can be a chore. If you have a laboratory that's full of denture technicians and none of them are really good at computers, that's going to be a challenge for you. And of course, the increasing cost of equipment. It used to be pretty inexpensive to get into the denture business with you get some brass flats and a press and buy some acrylic, and for a few $1,000s you're in the denture business. Not anymore. With this technology, it's very expensive, and the good equipment is even more, and it is definitely a barrier to entry.